experience colors what's going to happen in the future. And so if we can make experiences at the time better, we are likely to lead to good, strong relationships and then better outcomes for everyone involved. And I think enhancing education for everybody can help us to get there.
Transfer to the hospital is not a failed home birth or a failed birth center birth. It's safe and appropriate care for those births that need a higher level of care. When transfer is needed, midwives, emergency medical services, or EMS, and receiving hospital providers like obstetricians and nurse midwives function as a care team whether we recognize it or not. The birthing person and/or the baby are cared for by midwives, EMS, and receiving providers, the physicians, nurse midwives, and nurses in the hospital in turn. When we work together smoothly, we can improve outcomes and the experience of care for mothers and babies. Working as a team like this requires clear communication, understanding of each of our roles, and coordination of care. But few of us have received specific training on smooth community birth to hospital transfer. It is important for all providers involved in community birth transfers to try to move past hostility and bias and work to create functional relationships and systems change to provide effective care. How do we work together to provide smooth and safe transfer of care for those birthing people and babies who end up needing hospital care? Again, we understand that some of these best practices may not yet be possible in your location and that you'll need to adapt to fit your situation. We'll start with best practices in communication and then cover clinical best practices. Communication is key to smooth and safe transfer. As you'll remember from the introduction, the three main problems in transfers: misunderstanding between the different teams, misunderstanding of the severity of the situation, and misunderstanding of the scope and skills of each team member, are all based in communication. So we ask ourselves, what communication skills and practices are essential to smooth transfer? Each person involved needs to be able to communicate clearly about the situation, their role, and what is needed. We will talk about the transfer of care chronologically and discuss communication skills and best practices at each point in the transfer.